listening to Dr. Huma Ibrar, and today we are going to talk about very important topic and in a very interesting way, that is facial muscles. But before starting, if you still haven't subscribed my channel, kindly subscribe my channel and don't forget to click the bell icon. So the learning strategy is we will divide the face into 5 zones and we will use mnemonics to remember the muscles so that you will never forget the facial muscles again. And we will link every muscle with a simple action and finish with a quick clinical scenario to test the memory. The muscles of the face, often called the muscles of the facial expressions, are mimetic muscles, a group of more than 20 flat, thin muscles located in the subcutaneous tissues. So this is the thing to remember, 20 flat, thin skeletal muscles. They originate from the bone or fascia of the skull and insert directly into the skin, allowing them to pull the skin to create expressions. So these muscles are primarily categorized based on their location around facial orifices into 5 main zones: orbital, that is eye zone; nasal, that is nose zone; oral, that is mouth zone; auricular, that is ear zone; and epicranial, that is scalp or the forehead zone. So let's start. The first one is the scalp or the forehead zone, that is also known as epicranial zone. Muscles in the epicranial zone are frontalis, occipitalis, and the mnemonic to remember is front, back, cap. Frontalis raises eyebrows and wrinkles forehead. Occipitalis pulls scalp backward. So this is the frontalis muscle and this is the occipitalis muscle. The second one is ear zone, also known as auricular zone. Muscles included in the ear zone are auricularis anterior, auricularis superior, and auricularis posterior. Mnemonic to remember is ASP moves the auricle. A for auricle anterior, and S for auricularis superior, and P for auricularis posterior. So the auricularis anterior is for that pulls the ear forward, auricularis superior elevates the ear, and auricularis posterior pulls the ear backward. So here we go. Here we have anterior auricular muscle. This is the anterior auricular muscle. Now let's talk about superior auricular muscle. These are the superior. This is the superior auricular muscle. And this is the posterior auricular muscle. Let's talk about the third one, that is eye zone, also known as orbital zone. Muscles in the eye zone are Orbicularis Oculi, corrugate. Muscles included in the eye zone are Orbicularis Oculi and corrugator supercilii. Mnemonic to remember is OC protects the eye. O for Orbicularis Oculi and C for corrugator supercilii. Orbicularis Oculi closes the eyelids like blinking and squinting, and corrugator supercilii draws the eyebrows together like frowning. So this is the corrugator muscle, and this is the Orbicularis Oculi muscle, this one that surrounds the eye. Orbicularis Oculi muscle. The fourth one is the nose zone. Muscles included in the nose zone are nasalis, procerus, and depressor septi nasi. Mnemonic to remember is NPD shapes the nose. N for nasalis, P for procerus, and D for depressor septi nasi. Nasalis compresses or flares the nostrils. Procerus wrinkles bridge of the nose. Depressor septi nasi pulls the nasal septum downward. So here we go. This is the nasalis, this one, and procerus, this one is the procerus, and depressor septi, this is the depressor septi. The fifth one is the mouth and the cheek zone, also known as the oral zone. Muscles are Orbicularis Oris, Buccinator muscle, Zygomaticus major and minor, Risorius, levator labii superioris, levator anguli oris, depressor anguli oris, depressor labii inferioris, and mentalis. Mnemonic to remember, these are old, busy zebras run like lions during dark mornings. So this is the zygomaticus and major and the minor, that are the cheek muscles, masseter muscle, depressor anguli oris, depressor labii inferioris, and mentalis muscle, risorius muscle, orbicularis oris muscle, and levator superioris muscle. Functions of the mouth and the cheek muscles: orbicularis oris, that closes and protrudes the lips. Buccinator muscle compresses cheek like chewing and blowing. Zygomaticus major elevates the mouth corner like smiling. Zygomaticus minor elevates the upper lip. Risorius pulls the mouth corner laterally, and levator lifts the lip or mouth angle. Depressor lowers the lower lip or mouth angle, and the mentalis is for protrudes the lower lip and wrinkles the chin. So, super exam trick, there are the three words explain the most facial actions. You have to remember these three words always. Levator is always for lift, depressor is always for lower, and orbicularis is circulochlorium. Now, clinical scenarios. The first one is patient hears a sudden news and raises eyebrows. Forehead shows horizontal wrinkles. Which muscle is responsible? Share your answer in the comment section. Dust enters the eye and the patient closes the eyelids tightly. Which muscle performed this action? 3. Clinical scenario 3. A person is blowing air into a balloon. Cheeks compress during blowing. Which muscle is responsible? Number 4. A person smiles and mouth corners move upward. Which muscle mainly produces this movement? I have already uploaded many lectures on my YouTube channel, and the link is given below in the description box. So check it out and don't forget to subscribe my channel. So share your answers in the comment section. This is Dr. Huma Ibrar signing off.